This video is part of a series of evidence-based resources to share worker voices and supports the U.S. Surgeon General framework on addressing workplace mental health and well-being. I'm Dr. Lisa Yagers, professor, occupational therapist, and advocate for health and well-being. I presented this at the Total Worker Health Symposium held by the National Institute for Occupational Safety and Health at the National Institute of Health campus in Bethesda, Maryland.
I'm going to be talking about prison worker perceptions of diversity, equity, inclusion, and belonging, a health promotion needs assessment. And I led this study with the help of many master's research to get their help. So in 2020, the events that triggered national protests against systemic racism have further highlighted the need to explore related workplace issues. In the Midwest, state leadership have called for improving diversity, equity, inclusion in their workplaces. So this project is a result of state government saying, hey, we need to look at this. And discrimination is one of the most studied areas of racism, and it contributes to chronic stress and mental health issues among employees in the workplace. So I utilized the total worker health approach that I've utilized in other studies. The goals of this project were to explore the perceptions of DEIB among workers, determine if there are differences in perceptions between prison and probation parole sites, and then identify potential interventions to address these needs. So the project design, I worked with the Department of Corrections that employs over 11,000 employees statewide. We had executive level of approval and a participatory team of about 10. We designed focus group questions to explore DEIB related concerns and potential solutions. So what I did is I searched for any kind of survey tools and found that Harvard University had an employee survey to look at DE&I related issues, and I liked that they included this construct of belonging there. And then Washington State also had a survey. We had a total of 6 sites we randomly selected from across the state, 3 prison and 3 probation and parole districts. We performed virtual focus groups and then of course had IOB approvals. So in March of 2021, we had 9 1-hour focus groups out of 10 attempted. There were 47 participants with an average of 5 per focus group. Most worked second shift or day shift. 90% were non-custody staff, and then job titles included probation and parole officers, administrative duties, clerical, corrections officers, and unit supervisors. So these are the definitions that we utilize. So belonging, experience of being accepted, included, and valued by others. We also looked at bias, microaggression, micro inequity, and special advantage. The participatory team suggested that we not use the word privilege. So for analysis, we used the Atlas TI software, and we had 2 rounds of coding. So first, we had 2 independent coders look at all of the data, and the third person came in for consensus, and this was to rate the specific diversity, equity, inclusion, and belonging content. And then we did a second round and grouped constructs into themes of negative, positive, and suggestions related to DEIB. We used an Atlas TI co-occurrence table and code document tables for correlations. So in this table you see we had a total of 524 codes across all focus groups. Whenever we looked specifically at those DE&I concepts of belonging, bias, microaggression, micro inequity, and privilege, unfortunately we didn't get much from our participants. So as you can see, there are 128 codes from prisons and 143 from probation and parole. So we had similar amounts of content from each site and similar numbers of focus groups. So we found also in this sort of correlation coefficient analysis in Atlas TI, it's just looking at frequencies, but we see that highest areas for frequencies and those relationships were in the suggestions areas for management especially, and those positive and negative management areas were really coming out. So here's some quotes to show you some of our findings in terms of belonging. Here's a quote: since gender and age make up the majority of diversity here, any other diverse identity stands out like a sore thumb and is treated as other. So if you're just a little different, people don't seem to be willing to get to know you. In terms of bias, one quote is, inconsistency by management between different people or groups is apparent after reflecting on it. Microaggressions are occurring all the time but are overlooked and reports are not addressed. And micro inequities, if there is something that either gender can do, they still call on the male to do it. And And in terms of privilege, it occurs by certain people, not a group. Seniority plays a big part. So these are negative and positive codes by prison and probation and parole sites. And what we did is we tried to peel this onion. So we didn't get much information from those specific diversity constructs, but when we took all of those negative and positive responses and discussion by the focus group individuals, we found that when we coded it, belonging came out to be the highest frequency code for all of that content. The next area was workplace issues, and these are not related to DE&I. So the individuals use the focus groups as sort of a forum to get out their sort of concerns about the workplace itself. In addition, we also had suggestions and recoded those into different DE&I constructs, and we found that belonging again came out to be the most frequent construct. So these are suggestions for belonging across both prison and probation and parole sites. Suggestions were being willing to communicate, showing appreciation, lean in to hear everyone, mentorship, and seeing we're all together. So you can see like this building of community. They want for people to just acknowledge them. And then we also see other suggestions like allowing equal job responsibilities for men and women, treating others with respect, team building, don't tolerate discrimination, and so on. So in conclusion, sharing of diversity, equity, inclusion, and belonging perceptions, they were expensive. But in all summary blocks were negative, positive, and suggestions for these constructs, belonging was the most prominent code group. And furthermore, when comparing prison and probation and parole perceptions, the most notable difference was in the category of belonging. We also saw that when considering those social ecological levels, the strongest relationship for suggestions codes were found at the management level. So implications for this, we should continue exploring DEIB perceptions using safe approaches. As you can see, we didn't get much rich, robust DE&I information in this format. And our participatory group went round and round kind of considering how are we going to start exploring this. Surveys, they felt their employees had been over-surveyed due to other things, and so continue to explore ways to learn more. So we also want to look at multi-level interventions for building community and promoting belonging, as that's especially needed. And the participatory team continues to work on, one, they're asking executive leadership for a mentoring program, and that program is specifically going to look at management skills. So oftentimes you see managers who are promoted but not given the leadership training that they need to connect with workers. So that's one of the specific things that they're going to build from this. And then through ongoing needs assessment, they're going to do email well-being and wellness promotion tips and information blasts to workers. And in that, they're going to give a one-question survey poll to ask about things like, do you feel that you belong, or do you feel accepted in the workplace? And just try to keep assessing where workers are at. So these are the references, and we can open it up to questions if anyone has any.
See the show notes for more, and subscribe to this channel for additional health promotion content. Take care.